Real pleasure here, and I'm really grateful for Peter and Raf and Catherine and all the people who have made it possible for counselling to be involved in this program. I think I can say on behalf of the whole counselling community that it's an enormous privilege to be involved in CYP IAPT. I think many of us can recognise that the relationships, the links between IAPT and counselling and the counselling world in schools or in the community haven't always been ideal. But I think what the CYP IAPT program offers us is a set of values that I think we can all rally around personalisation of service, around giving people, young people the kind of service that they want, and also very much drawing on the views and the values of young people and responding in a way that young people really want. And I think this is something that the counselling community has really signed up to. It's been wonderful being here this morning, listening to the way that the IAPT and the CYP and the CAMS, specialist CAMS community has also really signed up for that. So it feels like a very positive way forward that can form a bridge between two communities that perhaps for the first time in this country will be a really solid foundation for streamlined pathways of care for young people. What's counselling? Well, counselling provides children, young people and young adults with an opportunity to explore their difficulties with a skilled, supportive and understanding professional, such that they're helped to overcome their distress, manage their problems and be more resilient. And there was an interesting article recently by the rapper Plan B, who recently released the film Ill Manners, sorry. Trying to be with the young people and not doing so well. But it was interesting, we just reading this recently, he said, I've had counselling since year 8. They called it sports counselling in my school, because otherwise kids would say, I ain't mad, I ain't going to see a therapist, which I think raises some of the issues about stigma that we've talked about. But he said it was just counselling, it was great, I loved it, it did me a world of good. Just in terms of what kind of counselling goes on in the UK, we know that about 70% of secondary schools have counselling, so that's about 65,000 young people a year are seeing a counsellor in a secondary school. About 95% of the universities have a counsellor, about 75%, 3/4 of the FE institutes. In the primary sector, in the primary school sector, a number of schools, like for instance Place to Be, have services in about 160 schools. But it is much more mixed in the primary sector in terms of what kind of counselling is available. But also, of course, with organisations like Youth Access, there's a big provision of counselling within the community-based sector. Youth Access alone has over 200 member organisations. Counselling is an evidence-based intervention. You know, sometimes people think it's a kind of tea and sympathy and a nice chat. But it's an evidence-based intervention that's there in the NICE guidelines for children and young people with mild depression. And we also know from our research that it's perceived by users, by stakeholders, as accessible, effective, often non-stigmatising, as you saw in the case of Plan B, not always, but often non-stigmatising. And then it's an intervention for a range of psychological difficulties. We often talk about counselling for psychological distress, kind of broad spectrum of difficulties that people can experience, particularly in relation to life problems, family difficulties, bullying, problems at schools, where young people feel that they can come to counselling and talk through their problems. And also levels of distress. We know from our research that actually the young people coming to counselling often have levels of distress that are very similar to those coming into CAMS services. So again, it's not a kind of tea and sympathy as it's sometimes been imagined, but is a rigorous, a systematic intervention for young people and children in distress. Having said that, there's obviously room for improvement. There's room for improvement around listening more to service users' views and understanding more what service users want. There's room for improvement in terms of outcome monitoring and evaluation and having counsellors using more monitoring in their work. There's room for improvement, I think, very much in terms of the relationship between counselling and CAMS services, about how they work together, referral pathways, care pathways. So this is really an opportunity for us, I think, to develop what our vision of is of the CYP IAPT kite mark counsellors Raf was talking about. So what is the CYP IAPT kite mark counsellor? Well, we think about it as someone who's going to provide an evidence-based intervention, who's going to be working from the evidence base, who's going to be integrating regular outcome and process evaluation into their practice, who's informed by users' views of counselling and works in a very collaborative way. Someone who's aware of and able to detect when there's mental health problems that they don't have the skills and the knowledge to deal with and are able to refer on. And also, I think very importantly, and I just want to re-emphasize this, I think this is a critical opportunity here to be able to develop and to work in ways where they're integrated and coherent with other CAM services, specialist CAM services. One of the questions for us is, what are the kind of models of excellence do we have for these kind of services? And I just wanted to talk a bit about one of the services by Bernardo's in Northern Ireland called the Time for Me Primary Counselling Service. This is the team here receiving a BACP award. This isn't one of the counsellors, by the way. But she is a apparently she is a therapist now. So they practice what's called client-directed outcome-informed therapy, which was developed by Scott Miller, Barry Duncan have been mentioned in the States, where there's a big emphasis on outcome monitoring and particularly tailoring the practice to the needs and the preferences of the young child. There's clear goals that are agreed with the assessment with the child and then with the family. And they use, very importantly, two measures, the child outcome rating scale, which Miranda talked about, and also the child session rating scale, which is a measure of the alliance that they use at the end of each therapy session. So what you have over here is this is the outcome rating scale, and here they mark on how they're doing at the beginning of sessions so that it can be tracked, and Duncan and people have been talking about that. But I think very importantly, also what they use at the end of sessions is something called the session rating scale. And here they ask the young person, how do you feel I did in terms of listening? You didn't listen to me or you listened to me? How important was it, what we talked about? And what we did today, was that, did you like it or didn't you like it? And overall, do you wish we had done something different or would you like to do more of the same this time? So they use this every session at the end of each session, and the children have a chance. We've been using this with children down to 7. I think it's validated down to 6. And it's really an opportunity for the children to talk about what works for them, whether they like it or not. In terms of the outcomes, we've seen really positive outcomes from this service. In terms of clinical levels of distress, around 3/4 of the kids come in using the cause, which, as Miranda was saying, isn't an ideal clinical measure, but it's still indicative, and there's results from the SDQ have shown something similar. Around 3/4 of the children were in the clinical range at the beginning of counselling, and by the end of the counselling that had reduced down to 10%. So I think you can see that there's big differences. This is the levels of distress, and the further they are along here, the more distressed they are. That's the numbers of children. And you can really see that at the beginning, a lot of the children in the service are right down to very, very high levels of distress. But by the end, many of them, in fact the majority, are at the highest level. So this is the kind of good practice, examples of good practice, that in the counselling community we want to be building on and learning from as a way of developing the kind of CYP IAPT type mark counselling standard. So the e-portal gives us a really valuable opportunity to enhance evidence-based, outcome-informed practice in the counselling sector. And in terms of how we developed this project, well, I was appointed as an interim advisor for counselling, and then I've been working with BACP, the British Association of Counselling and Psychotherapy, which is the largest professional body in the field, for a number of months now to develop a proposal and a bid for the e-portal. And what we're hoping with the next step is it's successful, that we can then move forward. And key for us will be extending collaboration to key organisations, stakeholders in the field, so organisations like Place to Be, like Relate, like Youth Access, like Young Minds. It's very important for us that this will be a collaboration within the counselling community and also working with other stakeholders, children, parents, and people from more specialised CAM services to really ensure that we've got an integrated training package that we're developing. In terms of timescale, well, by what we're hoping over the next 6 months will be to establish a steering group, looking at what the training needs are, looking at what existing e-learning material, there may be some very good e-learning material that's already out there that we can draw on, and developing a curriculum. One of the things we're also doing is we're developing a curriculum, a set of competencies with Tony Roth for counselling children and young people, which will very much inform this programme. The next year after that, we'll be developing the e-learning modules and the content, and then there'll be the promotion, launch, and of course an independent evaluation. One of the things that's really important for us in developing this work right from the start has been that we're not just creating something, we're not just creating a body of e-learning materials that are just going to sit there and nobody's ever going to use. So it's been essential to integrate it into the kind of training, CPD, accreditation and competency structures that are there through organisations like the British Association for Counselling and Psychotherapy. So that there's a legacy, so that the content will continue to be used and will form a critical part of counsellor training who are working with this client group. In terms of what it's going to look like, well, we're hoping to have about 35 half-hour sessions, structured within about 5 to 10 discrete modules. There's also a consortium that will be developing the other aspects of the e-learning, and it's obviously going to be important for us that we integrate very closely with the work that they're doing. And although the exact modules aren't clear yet because we haven't done the scoping, we're very much committed towards ensuring that there's a maximum synergy between the two projects. We'll be using a wide variety of formats, as Raf was talking about, trying to make it as engaging as possible through video clips, diagrams, tests of knowledge. And there'll be also resources for users, parents, and schools to tell them about what is counselling, how does it relate to other psychological interventions, when is it helpful, and when is it not helpful. Maximising the level of engagement, and the materials will be freely available through the e-learning for healthcare site, which I showed. It will probably be the e-learning for healthcare site or a site like this, which has a number. If you haven't seen this before, actually, it's a real, I'd really encourage people to go and have a look. It's a wonderful site, the e-learning for healthcare site, where there's a number of modules around a whole range of topics. And this will be where the counselling site, or somewhere similar, that the counselling site will be situated so that people can access it and be able to use the materials. As we're saying, you know, we're going to be going through a scoping process, and we're talking about the future here, so we're not entirely sure what the content will look like. But just to give you a rough idea, we'd like to do something around covering basic competencies for counselling children and young people. What are the basic skills, the basic relational skills that counsellors need to know about? Assessment, formulation, planning. Assessment isn't always used widely in the counselling community, and I think with the issue of detection and helping counsellors to know when a client may be beyond their skills, that assessment and planning will be very important skills. And then perhaps looking at interventions for specific disorders. Counsellors tend to work in fairly client-directed ways, but maybe there's opportunities, for instance, learning how to support young people using self-help programs for depression that we can be skilling up counsellors to know about so that they can link in more clearly with some of the care pathways and some of the specific treatment options that are available. Outcome monitoring and evaluation obviously is going to be a key part of the training. And also looking at work in particular sectors. So for instance, primary schools, secondary schools, the community voluntary sector, and also work in the independent sector. Supervision has been talked about today is going to be another key aspect. So skilling people up to supervise counsellors who are working with children and young people. And then also looking at counselling with young adults, whether that's in the community, through community settings as with youth access, whether it's in HE and FE sector about, again, the skills. And I think particularly outcome monitoring will be a key part of what we'll be training people up in. Now, there's a number of reasons why e-learning, I think, can be such a benefit in addition to face-to-face learning. We're not thinking that the e-learning with this or with the other programs will be replacing face-to-face learning, but there are certain advantages of it. For a start, it allows access to national and international expertise. We can have people like Barry Duncan talking about outcome monitoring in a way that isn't possible if the learning is just face-to-face. It's obviously cost-effective. There's a flexibility of use. People can do it in their own time. It doesn't have to be in specific scheduled times. It allows people to do personalised learning pathways so they can choose the modules that suit them in a very flexible way. They can monitor their progress, and it allows us to put up materials of sessions perhaps, or of counselling work with young people or with children that we wouldn't want to make freely available, but the internet allows us to password protect material in a way that makes it much more able to put important material up there. Just the final thing I want to talk about is that although this is about articulating and saying what counselling is and what we see as good counselling practice and developing competencies, as I was saying at the beginning, I think this is a real opportunity for the counselling community to ask some very important questions about our field as we develop the materials, as we develop our curriculum for CYP IAPT counselling practice. So for instance, we have questions like, what kind of assessment, diagnosis, detection skills would we want counsellors working with young people, children and young adults to have? Should they be able to have the skills to formally diagnose an eating disorder, or would we be expecting them to pick that up and refer that onto a more specialised CAM service? What about what kind of care pathways? Again, how will counsellors work with CAM services? How will they refer on? When will they refer on? What will they be involved in? And then I think another important question for us is, how can we really work to ensure that the communication between counselling services and more specialised CAM services is absolutely optimised? For instance, maybe we need modules or sessions which talk about how specialist CAM services work, who you would talk to. Maybe we need to use the e-learning resource in other ways, maybe a list of local CAM services that counsellors can link in with. And I think this is something that we'll be doing very much in development with specialist CAMS practitioners. And then thinking about evaluation, what tools should people in the counselling community be using? Would it be the same as Miranda and her colleagues are developing, or are there particular counselling-friendly tools? I think my initial sense is with some of the work that Duncan's been doing around goal-based outcome measures, that as I was saying at the beginning, I think the values here and the emphasis on goals and strengths and building on what young people can do and what they're good at very much links in with the counselling worldview in a way that I suspect will very much be able to articulate and have a very consistent set of measures, which I think will be ideal when we look at questions like, how can we have comparable evaluations? So we can actually see how counselling work and people using more non-directed methods are doing alongside people using other approaches like CBT, parent training. And there's also the question about how can we use the outcome data in supervision? I think in the counselling community we have a lot to learn about supervision. People are talking about videoed supervision. Counselling supervision can often be very flexible, very open-ended, which is often a good thing. But I think the opportunity to be able to use and bring this data into supervision so we can be looking at specific cases and specific clients and how these clients are developing and how they can be developed, I think would be very useful. Again, around referrals, questions around when should counsellors be referring onwards, and how do we train counsellors to know when to refer on to do that? And I think this can also work the other way around. This is an opportunity to think about when might it be appropriate for specialist CAM services to be referring into counselling, and to try and develop these two-way communications in a very positive way. And finally, to look at, are there particular evidence-based methods or interventions, perhaps exposure, that to some extent there may be ways that we can train this, or relaxation methods that counsellors in a more formal sense, often counsellors will have pick and mix, some of this, some of that, but actually that there's specific methods that we would be training them in so that they're able to use that, draw that into their practice and really be able to develop their work with children and young people. So just to summarise, just to say finally, I think the development of the e-learning for counselling programme and also other developments like the development of competencies for children and young people counselling really provides a unique opportunity to enhance the experience and outcomes for children, young people and young adults participating in counselling. And I think it can really help us to develop care pathways across services that are much more streamlined, accessible and effective. Thank you.